the platform Swiss Liver Patients Association, Swiss HEPA. Today with the presentations of Professor Dr. Jean-François Dufour, Clinic Director and Head Physician Hepatology, Inselspital, Bern, about the topic liver tumors. Welcome, Professor Dufour.
Thank you very much. It's a great pleasure to talk about this very important topic, which is liver cancer, hepatocellular carcinoma. This is not a rare disease. This is a disease with some specific features that are important to know. So I will talk about the epidemiology of liver cancer, how we diagnose it, what we can do to treat liver cancer, and also I will talk about surveillance for this cancer and how we can actually prevent the development of liver cancer. Epidemiology. Here you have data from the Bern HCC cohort regarding risk factors for liver cancer. You see that 32% of our patients have a liver cancer in the context of an alcohol-related liver disease. 18% due to this NAFLD, non-alcoholic fatty liver disease, is a metabolic disease not related to alcohol. Then you have viral hepatitis C in green, hepatitis B, 22%, and then 7% several other liver disease, which can also lead to a liver cancer. Now, if you look at the importance of liver cancer on the scale of the world, you have here on the x-axis the estimated death due to liver cancer or due to different cancer, and you have in the middle liver, and you have on the y-axis the estimated number of incident cases, new cases diagnosed with this cancer. So you see that's the number of deaths due to liver disease, due to liver cancer, is about 750,000, 800,000 per year. And this is just after lung and colorectal. So this is the number 3 in terms of death. Now, in terms of new cases, this is also about 750, 800,000 cases a year. And here is coming after lung, breast, colorectal cancer, prostate, and stomach. So this is not a rare disease. And you see already that this is a deadly disease. And these numbers will increase in the next years. This is a projection, but there are a whole literature about that, showing that in the next decades, the number of patients diagnosed with hepatocellular carcinoma and the number of deaths due to hepatocellular carcinoma will increase. Why this? Because there are 2 very important risk factors for liver cancer. Diabetes. You have here a very large study separating patients with diabetes and patients without diabetes. For the cumulative incidence of liver cancer, the difference is very clear. If you have a diabetes, you increase your risk to get a liver cancer. Same thing for obesity. Obesity actually increases the risk of many cancers, as you can see here, but one stands out really is liver, where the risk is increasing by a factor 4.5. So, because obesity and because diabetes will become more and more important, the numbers of patients with hepatocellular carcinoma will also increase. How do we diagnose this cancer? In contrary to many other tumors, we don't need to perform a biopsy, we don't need to have an histology. A radiological examination can reach the diagnosis. You can use a CT scan or an MRI, and you see here on this transversal slide of an abdomen. On the top, I show you that you have here, you see the back, then this is the front, and you have this large structure, which is the liver on the right of the image, on the left of the image, sorry, and on the right you have the spleen. So now below, there are 4 pictures of the liver. The figure A you don't see any content. This is before that we inject in the vessels a contrast agent. On B, you have the arterial phase. The contrast agent is now in the arteries, and you see some arteries in the liver, but you also see this lesion, this new lesion in the liver. And this lesion disappeared in the figure C, which is the venous phase, in the late venous phase on D. Now it's demarcate itself as somber as the other part of the liver, where you see the veins. So this washing in the arterial phase, in this washout, as we call that, in the venous phase, is diagnostic for hepatocellular carcinoma in the context of a cirrhosis. And so no need to perform a biopsy. So how do we treat patients with liver cancer? So you have to take into account not only the cancer itself, meaning the burden of the cancer, but also how the liver is working and in which state of health is the patient. There are three important parameters, and with 3 parameters, we can have different stage, 5 stage for hepatocellular carcinoma. In the stage very early, stage 0, that's why we call it, the tumor is less than 2 centimeters, there's only 1 lesion. The function of the liver is preserved, and this ECOG PS is null, meaning the patient is in good state of health. And here we can proceed to an ablation, meaning we place a needle in the lesion, we apply some electricity to burn the lesion, and the lesion will die. If it's not possible, we can also perform surgical resection to remove the part of the liver which has the tumor. If there is more tumors in the stage A, 1 lesion up to 5 centimeters or 3 lesions up to 3 centimeters each, we can speak of a transplantation. In this situation, we change the liver, meaning that patients receive a new liver with obviously no tumor, but also no cirrhosis. So this is a good strategy. The problem with that is that it's very important to maintain the patients while they are waiting for a new liver within this criteria to be transplanted. As the tumor remains small enough, 1 lesion up to 5 centimeters, 3 lesions up to 3. If it's not the case, we can try to perform downstaging, as we call that, with ablation. Now, if there are more tumors, we cannot perform surgery, we cannot perform transplantation, we go for chemoembolization. We place a small catheter in the artery in the liver to find the arteries feeding the tumor, and there we will place small beads to close the vessels, and so the tumor will not receive some blood and will die. Then, if there are tumors outside the liver, or even more tumors, then we have to go for systemic therapy. And here we are not using conventional chemotherapy. We are using very specific drugs, these multi-kinase inhibitors, as we call that. They inhibit important enzymes for cell proliferations and for formation of vessels. In first line, sorafenib or lenvatinib, and in second line, regorafenib, cabozantinib, and ramucirumab. But now this is changing. We have new drugs. We have the immuno-oncological drugs, these checkpoint inhibitors, which actually wake the immune system against the cancer. And we see, with some combinations, patients with liver cancer to have a long response with these treatments. Now, if the patient has a poor liver function, if the patient is in poor state of health, or if the tumor is very, very extensive, we have to go for the best supportive care. So you see at the bottom that the survival is decreasing as you progress in these different stages. But the first 2 stages have the hope to be curative, meaning that we want to free the patients from tumor. So in order to be able to do that more frequently, it's important to reach the diagnosis early. And there's a reason we try to enroll patients at risk in a surveillance program. So what is the principle of this? This is something which is not specific for liver cancer. This is done for other cancer, like for example, breast cancer. We need to identify a target population, patients at risk to develop this cancer. And then we have to apply regularly a test, a screening test, to find the tumor as an early stage. So for liver cancer, the population at risk is very clear. All the patients with cirrhosis, which is a deposition of scar in the liver tissue, could be due to hepatitis B, due to hepatitis C, due to TBC, which is an immune disease, other metabolic liver diseases. All patients with the cirrhosis have a risk which is high enough to justify their participation in a surveillance program. Now, there are also hepatitis B, which plays an important role. It's increasing the risk to develop a liver cancer. And so in some situations, as patients coming out of Asia with a certain age, they should also be included in the surveillance program. And in this surveillance program, we apply a screening test, which is a sonography of the liver every 6 months, twice a year. This is an exam which has no risk, is non-invasive, is well accepted by the patients, is relatively cheap, but is very dependent on who is doing this examination. Has to be well done to find small lesions. And with this, you can effectively change the prognosis of patients because the diagnosis is made at an early stage. In our data here, we have patients in a surveillance program in green and patients not in a surveillance program in the white bars. And you see that the proportion of patients in the curative treatment, 66% when they are in a surveillance program, only 15% where they are not in a surveillance program. So these patients have to be enrolled in a surveillance program. But still, probably the best strategy for liver cancer is to try to avoid to develop a liver disease or to try to avoid to develop a liver cancer. Here you see two maps of the world. On the left, you have the distribution of liver cancer in different countries. You see in red countries with a high incidence of liver cancer. And on the right, you see the map for hepatitis B. Clearly, there is a matching, and it's very clear that hepatitis B worldwide is a very important risk factor to develop liver cancer. So the best strategy here is to be vaccinated. We have a vaccine, we have a vaccination against hepatitis B since the 80s, has to be implemented. Everybody should be actually vaccinated against hepatitis B. And that reduces the risk to develop liver cancer. Now, the liver is also very sensitive on the way we are living, and there are several things here which may influence the risk to develop liver cancer. Coffee. Coffee is good for your liver. Coffee reduces the risk to develop a cirrhosis. Coffee reduces the risk to develop a cancer. Physical activity, sport, reduce the risk to develop liver cancer. Many data, experimental data, epidemiological data. Smoking is bad for everything, also for the liver, and increase the risk to develop cancer. And then the diet. What do we eat? How do we eat? Yes, this is very important. It is especially important to avoid to develop diabetes and not to be too fat. So the way to go is to take a bike and regularly bike your liver.
Many thanks for the instructive and exciting presentation and your great personal commitment, Professor Dufour.